Many patients wonder before having hip or knee replacement as to whether or not it's going to feel normal. And that's what I'm going to cover in today's video, so stick around to learn more. Hello and welcome back to the channel. If you're not already a subscriber, please consider subscribing. And if you enjoy this content, take a moment, click the little thumbs up button below. It really helps people like you find this content on the web. And if you've watched any of my videos or listened to my podcast or read my book, you understand that I'm a big proponent of patient education. I really think the patients should be educated on what they're getting themselves into, especially when they're considering surgery. And it's important because managing patient expectations results in happier patients if you have unrealistic expectations. No matter what the result is, it could be an excellent surgical result, but it's not what you expected. And then you're unhappy with the outcome. But when it comes to hip and knee replacement, we have a number of scoring systems that we can use to really quantify information when it comes to your function or range of motion or quality of life. In 2023, it was sort of this mandatory recommendation that institutions start collecting what's called PROMs, or patient-reported outcomes measures. And a lot of insurance carriers are actually requiring this as part of the approval process for surgery. And when we look at the different PROMs, there are a ton of options. So you got the Harris Hip Score, Knee Society Score, the VAS Score, WOMAC Score, UCLA, SF-12. And if that is not enough to make your head spin, then we have other scoring systems like the SF-36, the KOOS score, the HOOS score, and the Oxford Knee Score. And all of these scoring systems have their pros and cons, which is why people always come out with new scoring systems. When we use these scoring systems, though, both before surgery and at intervals after surgery, it really helps us with research to determine what things make a difference in people's lives. We want to make sure that they're better. And looking at these scoring systems before surgery also helps choose who should have surgery. Because if you have very, very high scores before surgery, it's near impossible to make you better after a surgery. Whereas if your scores are low, your pain is high, your quality of life is low, your function is low, there's a lot of room for improvement. But a lot of times for patients, these can be confusing, and you probably were given a number of these scoring systems at some point around the time of your surgery. But in 2012, another scoring system came out, which is quite simple, and it was called the Forgotten Joint Score. And what it did is it asked 12 questions, basically before surgery, whether or not we're talking about your hip or your knee. And do you notice your hip or knee when you sleep, when you drive, when you walk, when you play sports, when you get out of a chair? And people can then pick and choose, little to a lot, and it gives them a score. And it really lets them know on how much that hip or knee is impacting their awareness throughout the day. And then we can ask those same questions at intervals after surgery. Now, it's important for you to know that the hip has been called the forgotten joint. Hip replacement is an incredible operation. And the majority of people that have hip replacements after surgery do not notice their hip when they walk, when they drive, when they do activities, which is why it's been termed the forgotten joint. Now, that's good news if you're having a hip replacement. It's not so great news if you're having a knee replacement, because a knee replacement has not been referred to as the forgotten joint. A lot of patients that have knee replacements will still notice that there's something there. It just feels different. They hopefully have a decrease in their pain. They have an improvement in their function and their quality of life and their ability to participate in activities. But patients that have had a hip and a knee will always say that the hip feels more normal. It feels more natural, where the knee is better than the severely arthritic knee, but they still notice it. They're still aware of it. More recently, there's been another score called the Joint Awareness Score. This came out in 2023. And you might see this in some of the questionnaires in your doctor's office. And this is basically the same as the Forgotten Joint Score, but they just narrowed it down to 6 questions. So 6 questions to really assess your awareness of your joint before surgery and your awareness of your joint after surgery at intervals such as 3 months, 1 year, 2 years, 5 years, and so on and so on. So this is kind of a short video, but one, I wanted to address the idea of patient-reported outcome measures. So if you get asked to fill out a whole bunch of paperwork in the office before or after surgery, this is why. We're trying to quantify what your symptoms and quality of life are before surgery and how much improvement you had after surgery. It really helps us with research down the road, and it helps us educate patients on when they should choose to have a surgery and what the improvement in their symptoms would be after surgery. This is also important so you understand that the forgotten joint is the hip. So if you're having a hip and knee replacement, it's not apples to apples. That the hip replacement is probably going to feel more normal, more natural, and pain-free to you after successful surgery, where a knee replacement should improve your quality of life, decrease your pain, but you might always be aware of it. You just kind of notice that it's been replaced and something's there. It just doesn't feel as normal and as natural as a hip replacement. So I hope you found this interesting, educational, and if you enjoy this content, check out some of my other videos. Thanks again for watching. I'll see you next time. I'm Adam Rosen. Stay safe.